Welcome to the Voices of Empowered Parents podcast. Here, families, educators, and advocates and professionals come together to support children and strengthen the communities that help them thrive. I am your host, Dr. Julie M. Lane, founder of the Empowering Parents Network. Today, we're discussing an issue that touches nearly every family at some point in their parenting journey: access to affordable yet high quality childcare and early learning opportunities. For many parents, finding reliable childcare can feel overwhelming. Families are often balancing work responsibilities, financial pressures, and the desire to ensure that their children are receiving safe, nurturing, and enriching care. Yet, quality childcare is more than a convenience. It's a critical support that helps children develop, allows parents to participate in the workforce, and contributes to the overall well being of the community. Joining us today is Adonai Mack, Chief Executive Officer of Child Action, an organization that has been serving families in Sacramento County for more than 50 years. Under Adonai's leadership, Child Action continues its mission of advancing the education and social welfare of children and families by connecting parents with childcare resources, supporting childcare providers, and advocating for policies that strengthen families and promote educational opportunity and equity. With nearly 2 decades of experience in public education, policy, California politics, and equity initiatives, Adonai is deeply committed to ensuring that every child, especially those from historically underserved communities, has access to quality early learning and care. Adonai, welcome to Voices of Empowered Parents.
Thank you, Julie. I appreciate that. And I appreciate the long introduction. That was very nice. It was cool.
Great, great. Well, let's just get the ball rolling. And
Yeah.
why is access to affordable yet high quality childcare so important to children, families, and communities?
Well, I think there's two answers to that, at least from my standpoint and my perspective. The first thing is stable employment. Our families are individuals who are trying to uplift themselves out of poverty, and the way they can do that is by having a stable job. Being employed, having that economic stability allows them to move forward, to quite possibly increase and get promoted. Um, and that's meaningful for families. I think that it's also an investment in our workforce. By investing in our workforce, our employers can retain employees, can have some consistency. And so that's one side of it. And that's really what uh, childcare means to a lot of our families. I think the other side of it is really about having a safe environment for a child, an environment that is supporting the development of children, both socially, but also intellectually, and giving them an opportunity for their brains to develop, um, for them to grow, because certainly from birth to 5, these are critical times in a child's life where a lot of growth can really happen. And if they're in an environment that is really supporting that growth, what you will see is later on down the line, the benefit of having a child in a really safe and supportive environment. They will excel in their K-12. They will excel as citizens and members of the community. And so I think that when you talk about affordable childcare and what it means, it's about economic stability and supporting our children.
And the affordability piece is what I guess shocks me, at least as a grandparent now,
Yeah.
knowing what my children are paying for childcare, especially in in the Bay Area, in this area of California. It's like it's almost more than a mortgage payment. It's
Yeah,
crazy.
it's ridiculous. I mean, we're in Sacramento County. It's the same type of thing. It's really, unfortunately, the cost associated for caring for children is extremely high, and 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 on the other side of that, the state hasn't made the investment, or even our local communities haven't made the investment necessary to allow for either a universal system, which is what we all desire, or even a system that can, to some extent, subsidize the high costs of caring for children. Um, I think it's a systematic issue that, quite frankly, as a policymaker, like, no one has really figured out what it looks like and what it means. I take that back. We have figured it out. We just don't have any legislative leaderships who have the courage to say, we're actually going to spend money on this as opposed to something else in our state budget.
Um, no, and I can just envision um, how that can change the the dynamics and the significance of that change if we had that universal system, especially for the underserved communities, which is also an area of passion for me, is getting into
Yeah.
those communities and helping them understand special education law. But when we talk about access to reliable childcare that transform lives of families by creating opportunities, what's the long-term economic stability for that?
Um, when you're talking about the long-term impact, I think that certainly what I've seen and what we've seen in testimonials from our families is we hear stories about um, parents being able to graduate high school, parents being able to finish college. I have someone that I have a relationship with now that has become a colleague of mine where she went through a really tough period being divorced, having two children, being a single mother all of a sudden. Child Action helped her get through college, become an entrepreneur. And when I met her, she had just bought a building on a block. And so we hear these stories, and that's when we know, like, this is what this investment really means. This is what the access looks like, is that you have families, you have parents that are able to, because their children are being taken care of, now they can increase their salaries. They can go from making, I don't know, $1,500 or $2,000 a month to making $7,000 a month. And it's because their children are being cared for, and they were able to get on our program and then ease their way off of their program when it becomes more affordable for them. And I think that that's really what this looks like. And I think the other piece too is that I think sometimes our policymakers tend to misunderstand actually what it means to invest in something like this, invest in childcare, because there's a lot of different research that every dollar invested is like $7 of economic activity or $12 of economic activity. And really what that means is that people have the opportunity to work. They have an opportunity to engage, and then they're spending their dollars doing something else, whether it's a mortgage or rate or taxes or groceries. It's generating um, prosperity for everyone.
So when I think about, and I think a bit like you, very visionary, knowing, being able to systematically connect the dots.
Mhm.
How can we help policymakers or others understand how by planting that one seed, through child action, how it feeds into the economy on a much broader scale?
Um, I think that part of it is, given sort of where we are now in our society, um, I think one of it is, a lot of it is data, being able to show the data, um, being able to connect the dots between the money spent and the impact that it has on families. It's some of it is anecdotal, right? It's going to be the stories. The stories always help. But I think the other side of it is the use of data, is being able to It's interesting you say it because I just had this conversation the other day with my staff. It's about being able to take the data and then showing, here's where the impact is in this area. Here is where there is a lack of care, right? A lack of access to care. And this is what it's doing to this area. And so using the data to really tell a story, and to put pictures to it so that policymakers really can get a full grasp of what it means. Um, and then building in the advocacy around that. So one of my, probably one of the things that to some extent irritates me the most is from a local perspective. Our local government entities sort of are like, well, the state's paying for it or the federal government is paying for it. And we're really at a point where we're pushing them for them to understand and recognize that the issue is bigger than just state and federal dollars. Like, there's a role that our local communities have, whether it's local government or our business community, there's a role that they have. And so when we come in, so especially my team and I, when we're advocating and we're having conversations, it really is using the data to tell the story that we believe is necessary. So sometimes we're having conversations with our business community and we're talking about the retention of employees. We're talking about employee benefits, um, the culture or employee satisfaction, and what it means to have employees that are going to continue to show up because the data that I see is the when employees miss days from work, it's mostly because of their children. And so giving them that information and then helping them be a partner with us on how to solve some of these access issues as well as some of these cost issues.
That's awesome. I was thinking about when I'm working with educators and they're frustrated because parents don't come to back to school night or parent teacher conferences. It's often because they don't have childcare.
Yeah.
They don't have some place for their children to go. So, in my own work with empowering parents, whenever we're offering workshops, we're saying, okay, who can we partner with to do the childcare component so those
Right.
parents show up?
Right. Right. That's exactly right. Cause and one other thing too is I mean, what you're talking about right now is probably one of the biggest issues that often our families face. And depending on the industry that they're in, is while our child, like many of our childcare providers will provide hours like from 6 a.m. to 6 p.m., it's generally, especially in the food service industry, those hours or manufacturing, those hours from like 6 p.m. until 6 a.m. the next day, those non traditional hours, that's where a lot of our families are going to struggle because not many people offer that or they're willing to offer that. And and that means as policymakers and what we have to do as advocates is we have to push policymakers to think about, to understand and think about what it means to provide sort of resources in a different way so that you can incentivize um, individuals who want to provide hours that are non-traditional. Um, because we do have a group of families, right? They could be working in healthcare. They could be police officers or firefighters. They're not working from 6 a.m. to 6 p.m. every day.
And I would even throw the weekend in there.
Yep,
We have a lot of
exactly.
families work on weekends.
Yep, yep.
Absolutely. So what challenges are childcare providers facing today? And why is it important to invest in and support the professionals who care for those children?
I would say that some of the challenge that they're facing is an underfunded system. So, they don't, they may have to charge a higher rate because it costs that much to operate. And the state is not supporting, the state is not supporting the system in a way that's beneficial. So resources is certainly a piece of it. Um, I think also it's to some extent, we're talking about small businesses and individuals who maybe don't have the expertise of what it means to operate a small business. And so, how to market to folks, how to um, structure things, how to use technology to improve operations. I think on the operation side, that sometimes is maybe what's missing because generally we're talking about folks who care about kids, they're educators, um, and many may not have the business expertise in order to be sustainable, to think about expansion in that sense. Um, and then it's resources, right? Is we we operate, especially in California, we operate on a reimbursement system that is from 2000. We're reimbursing folks on 2018 rates, and that's an issue. We're not looking at our state hasn't looked at what the cost is versus what we're going to actually invest in as a state. And so I think that is really one of the challenges. Um, and so with all those challenges, then it is if the state wants to push things in a certain way in terms of, well, we want you to do this with children. We want you to be able to do these things with children. They're not providing the resources to do that. Um, and you add in all the different ratios, and really what's happening is we have built a system and then not funded that system effectively. And that often is probably some of the biggest challenges that our providers have.
I'm curious, is there also a shortage of um, actually the daycare employees, the provider themselves,
Yeah.
seeing that in education, of course. So is that also occurring in childcare?
Yeah, that's certainly the case. I think it's finding the individuals who actually, whether it's the teacher's assistants or the additional staff that's necessary in either a center or a family child care home, just finding the people. That's certainly the challenge. And a lot of that stems from, if individuals are making a certain hourly rate at, I don't know, maybe it's Target, maybe it's um, in a restaurant. Childcare providers can't always provide an equivalent rate because they may not have the resources. And so it's either they may not have the resources for because the state's not providing enough, or they have to charge really high rates to families, and there may not be the families that can pay for that. And so yeah, it's certainly a challenge to find the actual individuals to work in childcare. It's why we have created programs like apprenticeship programs to get people into the pipeline. Um, and I would also say too, I don't. It's kind of similar to education, right? Like education doesn't necessarily market being a teacher as a career choice. Um, and I think it's same with childcare. I just we don't highlight the work, the meaningful aspect of the work, and then quite frankly, probably we can't always pay folks what they need a living wage in order for them to survive.
And I think the US is unique in that other countries perceive educators, childcare, on the echelon of lawyers, doctors. They're highly
Right.
respected. They're paid incredibly well. Um, their preparation university programs are selective. They have
Hmm.
waiting lists. Not everyone gets in, and we just don't have that cultural uh, expectation in the U.S.
Yeah. Yeah. No, I agree. I think it's it is sort of a U.S. cultural aspect of it. Um, and I think also then what happens, right, is to some extent, you don't value it as high, so you don't invest in it, right? Like a lot of times when I was a lobbyist and I was an advocate, the talking point was the budget should reflect what you value. And when you're not spending resources or investing resources a certain way, you're just demonstrating us whether you value it or not. And I think that's often been the case in the United States.
Yeah, absolutely. Absolutely. Um, Talk a bit about what steps are being taken now to advance access to childcare services and how parents and providers help advocate for stronger support systems within their communities.
Cool. Um, so for us, uh, we're really looking at, we kind of look at this at maybe a couple of different tiers. And I think maybe I'll just start with the largest and then kind of go all the way down. I think that we believe in being strong advocates at the federal level. And so we participate with our membership groups to go to our nation's capital, meet with our congressional members, to articulate what the needs look like. So sometimes that's resources in terms of increasing the overall amount of funding. Sometimes it is uh, giving very specific funding so that we can implement something that we think will be a more innovative approach or helping us with some efficiencies. Just give you an idea, um, we're trying to help our childcare providers move to what's called digital attendance. And what that would do is families can sign in and sign out of when they come into care with like a QR code, which then keeps track of their hours instead of signing the paper that they were here for a particular point in time, right? What happens with the paper is the paper lends itself to fraud. And, like fraud is a big issue that everyone's talking about. And so it lends itself to fraud. But if you have digital attendance, it makes it easier to track things and it allows us to process payments a lot faster. And so folks can get paid faster. And so I think when we're looking at that, it's about how do we incentivize a digital attendance? And if there's some technology issues, how can we alleviate those? So us working with our federal congregation and saying, hey, invest in this, it'll allow us to implement this program like digital attendance. It's things like that. Um, I think then at the state level, we do something very similar. We need to change our system. We talk about um, a cost-based formula for reimbursement rates. We're talking about initiatives, right? We look at New Mexico and we're saying, how can New Mexico have a universal system, but California can't? And we're the fourth largest economy in the world. There's a problem there. So it's really pushing our legislator, our governor to invest in a universal system. We can do that through an initiative, having our partners all together to do that. Um, I think, and then finally, it's really about our local government is really pushing our council members, our supervisors to invest in childcare. Now, that might mean a local initiative where there is funding allocated specifically for the care for children. Um, it also could mean doing something around providing resources that is outside of our state subsidy program. And so we can reach more families that are above the 85% of state median income. We can sort of get 85 to maybe 150 or 200% of state median income. That means we're really impacting a lot of different families that really need us. And so that's one aspect, and that's kind of the work that we do as an organization. I think the other piece is we engage our providers and our families to be advocates and train them how to do that. And so we have actually built a parent and provider advocacy council where we bring in parents and providers. We talk to them about the issues. We train them on what issues to talk about, how to talk about them, how to tell their story. Um, and then when there's opportunities for them to meet with legislators, we have them visit their centers or their homes. Then we have them at the Capitol. We bring them into city council meetings to testify about issues. Um, it's those things that we're really investing in and investing our time to ensure that as we look at what the entire system looks like, we're using the families, the providers, as a storytellers and building their advocacy skills because it's going to take more than just child action to do it. We need a lot of different voices. And I think that what's occurring now is we're really building a groundswell of folks to help shape the system so that it's better than what it is now and we receive the resources that are necessary.
Awesome. As you were talking, I'm thinking about our work with empowering parents, which is helping parents become advocates for their children in
Yep.
school,
Yep.
and
Yep.
not needing to pay an advocate to have a voice,
Right.
but to actually empower them with that knowledge. So it sounds a little bit familiar to the
Yeah.
work that
Yeah.
we're
Yeah.
doing as well.
Yeah.
So, Adonai, as we wind up our time together, is there anything else you'd like to share with our listeners today?
Um, I would say this. I think that I look at our work as an opportunity to support families and to reshape their opportunities that exist. I tell the team all the time, at the end of the day, yes, we were created to provide a service around the support of families through the use of childcare. But I think our bigger mission is to help people get out of poverty. It's to help people get out of poverty, help change the trajectory of children, um, and we can do that by a lot of different means. And at the end of the day, if we help folks and they come back and they tell us stories about, hey, we used you and um, this is what my life looks like now. So thank you. You really helped us navigate something. I think we can all sleep well at night. That we did our best as an organization to support families, um, help them get out of poverty, and help them with whatever they're facing, whatever challenges that they're facing. Um, and that's just what I believe as an organization.
Wonderful. Thank you so much. Um, this conversation reminds us that childcare is as much about not just their supervision, but it creates this opportunity for children to learn and grow and allows parents to pursue employment and education. It strengthens the economy and it helps build healthier communities. Adonai, thank you for joining us today and for sharing your insights, your leadership, and your passion for supporting children and families. And for our parents listening today, we hope this discussion encourages you to seek out the resources and support available in your community. Many families are unaware that local agencies can help them navigate childcare options, connect with providers, and access financial assistance programs that make quality care more attainable. Thank you for joining us again today for another
Thank you, Julie.
Voice of
Appreciate it.
Empowered Parents. If you found this conversation helpful, please share it with another parent, caregiver, educator, or community leader who may benefit from learning more about the vital role of childcare and how it plays into the support of families. Until next time, keep advocating, keep connecting, and keep empowering the children and families in your community. This is Dr. Julie M. Lane. I look forward to seeing you next week.